My name is Shannon, and I have TMJ disorder. I could hardly speak or eat without trouble. The chronic pain made it difficult to spend time with family, work, or even function. At first, like many others, I tried different treatments but never found relief. Night guards and exercises work well for a lot of people, but they weren't the right solution for me.
Shannon was referred to me by our surgical team because she needed specialized care from an orofacial pain specialist. The dysfunction in her jaw was causing severe pain that was radiating into her neck and her head. When patients come to us, we use advanced technology to take a deep dive and to gain a better understanding of the whole picture. Because Shannon is allergic to the prosthesis, we needed to create a personalized care plan to address her specific needs. Through conservative methods, including a new custom TMJ mouth guard, medications, Botox, trigger point injections, self-care, and a custom diet, we're able to effectively manage her symptoms together.
Dr. Robbins is my hero. Without him and the team at CCOFS, I would still be struggling.
Our multidisciplinary team delivers world-class care using state-of-the-art diagnostics and techniques. We have the expertise and experience to provide comprehensive, conservative, and surgical treatments all at one place. And our advanced training allows us to recommend the most effective pain management options.
TMJ may be a lifelong condition, but you don't have to let it stop you from living. Because of Dr. Robbins and the care I received at CCOFS, I can laugh with my husband and enjoy life. It can be hard to transition to a new practice after so many attempts at finding lasting relief, but I'm glad I did. If you suffer from TMJ symptoms like me, don't wait until it becomes more painful or costly. Get care from the experts who can truly take you from just surviving to thriving.